Brain injuries are commonly associated with head trauma and result in part from displacement and distortion of the nervous tissue at the moment of the impact. Various degrees of brain injury are described by very specific terms. For instance, a concussion is an injury characterized by an abrupt but temporary loss of consciousness, may last from seconds to hours, disturbances of vision, and problems with equilibrium. It's usually caused by a blow to the head or a sudden stopping of movement, such as what happens in an automobile accident. It is the most common type of brain injury. A concussion usually produces no obvious bruising of the brain, so signs of a concussion are headache, drowsiness, nausea and vomiting, lack of concentration, confusion, and possibly even some slight memory loss. There's been a lot of press coverage and a lot of public interest and concern about a condition called chronic traumatic encephalopathy. Encephalopathy, pathology within the head. It's a progressive and degenerative brain disorder that's caused by repeated concussions or other head injuries, such as you see with athletes who participate in contact sports like football and hockey and boxing. And also you see this very frequently in combat veterans and individuals with a history of repetitive brain trauma. Possible symptoms of CTE include memory loss, confusion, impulsive or erratic behavior, impaired judgment, depression, aggression, paranoia, difficulty with balance and motor skills, and sometimes even dementia. A contusion is a bruising due to trauma and includes the leaking of blood from the tiny little microscopic blood vessels located within the brain. It's usually associated with a concussion. In a contusion, the pia mater may be torn, and that allows blood to enter the subarachnoid space. The most commonly affected area is the frontal lobe. A contusion usually results in the immediate loss of consciousness, usually doesn't last any longer than 5 minutes though, may also cause a lack of reflexes, perhaps even the stopping of breathing for a moment, a decrease in blood pressure. Vital signs usually will stabilize after a few seconds. A laceration, usually from a skull fracture or a gunshot wound, results in the rupture of large blood vessels and then, of course, bleeding into the brain and the subarachnoid space. Consequences of this bleeding include cerebral hematomas or pools of blood that swell against the brain tissue, edema, and both of these lead to increased intracranial pressure. If the clot is small enough, it may not possess any threat and may be just resorbed by the body. But if the clot's a large blood clot, it may require surgical removal. These clots and swellings, of course, are going to push on the area of the brain tissue because only so much extra space is there, right? So extra fluid, extra swelling only has so far that it can basically increase the contents of the cavity before it starts pushing back into the brain and then impairing function. So swelling can cause excruciating headaches. Brain tissue can also undergo necrosis or cell death due to this swelling. And if the swelling is severe enough, the brain can herniate through the foramen magnum or push down through the hole. And as it does so, of course, that's going to result in death. The most common brain disorder is a cerebrovascular accident, or what we commonly call a stroke. CVAs affect about 500,000 people each year in the United States. It's the third leading cause of death behind heart attacks and cancer. A CVA is characterized by a very quick onset of persisting or long-lasting neurological symptoms such as paralysis or the loss of sensation that arise from the destruction of brain tissue. Common causes of CVA include hemorrhage within the brain, blood clots, or atherosclerosis, the formation of those cholesterol plaques that block blood flow. Risk factors for CVA are high blood pressure, high cholesterol, heart disease, narrowed carotid arteries that supply blood to the brain, TIAs that we'll look at next, diabetes, obesity, and excessive alcohol intake. This usually results in paralysis on one side, sensory defects, as we mentioned, and the difficulty in speaking. Transient ischemic attacks are caused by impaired blood flow to a particular part of the brain. They usually only last about 5 to 10 minutes and hardly ever more than 24 hours. TIAs leave no permanent neurological defects, and about 1/3 of patients who experience a TIA will also have a cardiovascular or a cerebrovascular accident. Alzheimer's disease is the most common form of senile dementia, affecting 5 to 15% of people over the age of 65. Although the cause of Alzheimer's is unknown, evidence suggests that it's a combination of things such as genetic factors, environmental or lifestyle factors, and just simply the aging process. Individuals that have Alzheimer's disease usually have trouble remembering recent events. That leads them to get confused and become even more forgetful, and they very often will repeat questions over and over again. They get lost while traveling to the grocery store where they've been 100 times. This may lead to increasing episodes of paranoia, hallucinations, violent mood changes. People with advanced Alzheimer's may also lose their ability to read, to write, to talk, or to even walk. There are some things associated with Alzheimer's disease, such as a shortage in the neurons that liberate acetylcholine, in especially the cerebral cortex and the limbic system. And those, of course, we know are involved in cognition or recognition of things, being able to think, and forming and retaining memories. Also, you see a deterioration in the hippocampus, which forms memories, and an accumulation of plaques and tangles. The plaques are clusters of abnormal proteins that are build up outside of the neurons, and the tangles are abnormal bundles of filaments inside the neurons. So all of these plaques and tangles interfere with normal transmission of nerve impulses. Parkinson's disease is a degeneration of the neurons that release the neurotransmitter dopamine. Usually affects people over the age of 60. Patients with Parkinson's disease have involuntary skeletal contractions, and a lot of times these involuntary contractions can interfere with voluntary movement. Muscle tone may increase greatly and cause a specific part of the body to become rigid. There may be a slowness of movements. Walking is often impaired, with steps becoming shorter and shuffling. Sometimes speech is affected. Drugs cannot cure this, but there are some drugs that aim to keep dopamine in the synapse longer, so it works on the dopamine can then affect the postsynaptic nerve cells more. But of course, as I said, there are no drugs that can cure Parkinson's disease. One of the things that's looking at now is transplanting dopamine-rich fetal nervous tissue into the brain of patients that have severe Parkinson's disease. Only a few patients have shown improvement with this, so there is still a lot of work to be done in researching this area. Huntington's disease is an inherited disorder which typically affects people that are middle-aged. It leads to the accumulation of a Huntington, not Huntington's, but Huntington protein that accumulates in the brain, and that leads to neurons dying. It's characterized by chorea, which that simply means a dance, where you have very rapid, jerky movements occurring involuntarily and without reason. This usually results in fatality within 10 to 20 years after the first symptoms appear. It is progressive, with a lot of mental deterioration occurring quite quickly as these proteins accumulate in the brain. So with the overstimulation of the motor drive causing all of these involuntary contractions, some of the drugs that are given to treat Huntington's disease are drugs that block dopamine. Now remember back that dopamine, when we talked about neurotransmitters back in the early part of the nervous system, the dopamine was going to help regulate some of skeletal muscle tone and movements due to those skeletal muscle contractions. So by blocking dopamine, it's thought that this will decrease those involuntary contractions. Cerebral palsy is a motor disorder that results in the loss of muscle control and coordination caused by damage of the motor areas of the brain during fetal life, so before birth, at birth, or during infancy. Radiation during fetal life, temporary lack of oxygen that may occur during the birthing process, or hydrocephalus, water on the brain during infancy, can also cause CP. Of course, this is going to result in seizures, loss of muscle control, may have deafness and visual impairment as well. This particular image shows you different types of CP and the brain areas that are involved. If you are taking my test, I'm not going to ask you about these different types, just the overall idea of what cerebral palsy is, the things that cause it. In just a few clinical terms to finish up things, autism is a developmental neurological disorder in which people typically have difficulty communicating or responding to other people, as well as forming relationships. There are many different types of diagnosed autism, each of which has a different characterization of how that is manifested in the person. However, it is quite prevalent in our society, affecting 2 out of every 1,000 people. Hypersomnia. Somnia means sleep and hyper means above. So this is a disorder in which a person may sleep up to 15 hours a day. Now personally, I have great difficulty understanding this because I have insomnia, or the inability to sleep. And then myelitis is an inflammation of the spinal cord and of course the connective tissues that surround that. Anytime there's inflammation in a closed space, then that can lead to impair of function. And I know you've all experienced myoclonus. I hope you didn't do so during this video, but it's when you're sitting there and you lose your focus and you start to fall asleep. And as you reactivate your reticular activating system to become aware again, those muscle jerks move you back, move your body back into position. So perhaps your head was drooping and you dropped your pencil, and then those muscles jerk when you come back to awareness. Neuroses are mental illnesses such as anxieties or phobias, obsessive compulsive disorders, but the common factor with these is that you do retain contact with reality, as compared to a psychosis in which it is a mental illness where you lose touch with reality and things that are not real become very real to a person suffering from a particular psychosis, such as schizophrenia and manic depressive disorders. During development, the nervous system begins to develop during the 3rd week of gestation. But the hypothalamus is the last area to fully develop and become mature. Remember, your hypothalamus is your body's chemist and regulator. So the hypothalamus is responsible for thermoregulation. Because premature infants have not had time in the uterus for the hypothalamus to fully develop, it's vitally important that those premature babies keep a constant maintenance of temperature externally. So we have to keep them wrapped in blankets even though the weather outside may be warm. They do have less ability to maintain their own body temperature. And also the visual cortex is not fully active in a newborn infant, so they see very poorly. However, they do respond quite easily and quite readily to auditory stimulus. So vision develops as the child ages. Usually at several stages during fetal development, an ultrasound will be done to check for any deformations, or if the baby is not progressing in its growth as it should be while in the uterus. A very sad but very fatal, or usually fatal condition, is anencephaly or acrania. So a means without, so without a head, or an means without. Now, it's not necessary that not necessarily meaning there's not a head, but it does tend to mean that a part of the brain and the cerebrum have failed to develop. And of course, remember, the cranial bones of the fetus are not going to be fully ossified, so a lot of connective tissue there. And of course, it's the developing brain that pushes against those bones and causes the cranium to grow. So a very, very small, underdeveloped head can be indicative of the brain not developing well. Of course, an infant born with this condition, with a lack or defect in the brain tissue, is typically going to be unable to respond or process input, and unfortunately death occurs very quickly after birth. So from birth to aging, from early adulthood until the end of life, brain mass declines. By the time a person reaches about 80, the brain weighs about 7% less than it did when you were a nice, young, healthy adult. The number of neurons present doesn't decrease very much, although it does decrease some, but the number of synapses decreases much more so than the decrease in the number of neurons. This leads, of course, to a decreased ability to be able to detect stimulus and to conduct nerve impulses to and from the brain and to process that information. Also leads to a decrease in the conduction velocity, so voluntary motor movements slow down and reflex time is going to decrease. In addition, we have degenerative changes in the receptors for vision, hearing, taste, sight, smell, touch, and balance, as well as the processing or association of that, and then of course any motor actions that result as or should result because of that stimulus and association. So basically, again, as we've seen with most of the body systems, as we age, we do tend to lose some function. So the better you take care of yourself during your developmental years, during your young adult years, the more likely you are to retain function as you age. However, aging is a part of the process, and that decrease in function is something that we can't stop completely. However, in most cases, we can slow it down a bit.